Good afternoon. Thank you for joining us for the Ask a Radiologist webinar series. Before we get started, I'm going to share some housekeeping items for today's webinar. Everyone on the call will remain muted for the duration of the webinar. At the end of the webinar, we will open the floor for live Q&A. We encourage you to ask questions, and you can submit your questions at any time using the chat box feature in the Zoom platform. If you would like to ask your question live, simply click on the Raise Your Hand button and we will unmute you during the Q&A portion. For today's webinar, we are joined by Dr. Mahanty and Stephen Downey. We also have your physician liaison, Travis Roseborough, on the phone. If you have any needs regarding patient education, referral forms, or other materials, Travis can stop by for a visit at your practice. Dr. Scott Mahanty is a board-certified radiologist with a subspecialty in musculoskeletal radiology. Dr. Mahanty completed his residency at the University of California, San Francisco, and his fellowship at New York University. He has been practicing with Charlotte Radiology for 4 years and is actively involved in the operations and recruitment committees. Dr. Mahanty's priorities include, but are not limited to, his 6-month-old Australian Shepherd, hiking the next mountain, and a well-curated sleep schedule. Stephen Downey is the manager of MRI services and is the MRI safety officer. Stephen has over 20 years of experience as an MRI technologist and has worked at Charlotte Radiology since 2010. Stephen is committed to delivering compassionate care to patients and leads Charlotte Radiology's Image of Care program to employees. In Stephen's spare time, he loves coaching sports and being a girl dad to his 3 daughters. I'll now pass it over to Stephen to kick off the presentation.
Hi, everyone. Welcome to our presentation today. We appreciate you taking a few moments of your time to sit down with us and join us as we talk about some exciting changes we have here at Charlotte Radiology, specifically with our new MRI technology. Over the years, and as the introduction said, which you were so kind for, I've been clinical MRI technologist for 20 years. And so I've seen a lot of things come and go and had a lot of patient experiences during those times. So to get us started here, this new imaging technology that we have, we're looking at changing the perception of what it means to have an MRI. And what I have come to learn over the years is that perception is reality to our patients, and what they perceive, even from the very beginning or from a bad experience they were told about, they bring that energy with them to our office and for our to our appointments for our treatment. So MRI has typically, when you tell a patient, I'm scheduling you for an MRI, I believe most patients see that as a necessary evil or something negative to go have an MRI. It's going to be a very bad experience. It's going to be so loud. It's going to take so long. And what I've also experienced over the years is that I believe many people, once they've had an MRI and they go to tell someone about it, they want to kind of glam it up a little bit. They want to Hollywood it and make it even worse than what it actually was, which leads to a false experience that they're sharing with a family or friend or coworker or whatever. And so then that coworker comes in leaning on what their coworker has told them. And so now they're already scared of this system, and they're already worried or scared, afraid. And now they're going to fail just based on the anxiety that they're bringing in. And even if they do get through it, it's going to be terrifying for them. And in my reality, in my experience over the last 20 years, it does seem that more people have probably seen Bigfoot than have actually left out of an MRI system with a great experience. So how do we change their perception? Let's start with, again, going back and thinking about how your patient feels when you tell them they need an MRI. Are they thinking about, say, the image on the right here, where we have, 2 technologists right beside them, standing beside the scanner with headphones on in a big open space? Or are they thinking more of what is on the left here, which is basically a fancy coffin with barely a way to see into it? And what I've seen clinically, most people come in believing the MRI system is going to be a coffin. And the reality is more of what you see on the right, where you have compassionate caregivers ready to take care of them. So how do we address these needs that we see with our patients? We see our patients present here with psychological, emotional, or maybe even a physical. So here at Charlotte Radiology, our technology that we've achieved and we've acquired and we're putting to use, we're going to start with our wide open bore technology. That's going to be a cylinder of the MRI, which is approximately 5.5 inches all the way around, larger than a standard MRI scanner. That means you're going to have so much more room. You're not going to be pressed from the sides. You're going to have much more room to kind of get comfortable, if you will, and kind of settle into something that doesn't feel like it's about to smash you. The second part we're going to talk about is the carrying suite design. Our carrying suite are the lights that you see around the upper part of the picture on the right, as well as our lighted wall panels. And then the ceiling image, which gives the feel or the presentation that you're actually looking outside, because we all know that just being able to see something other than the inside of a healthcare facility's walls can go a long way psychologically. The big thing we're really proud of here that is our new Recon deep learning software. And this really is going to be our game changer for our patients. It comes with improved image quality for better specificity, better MR image. You're going to get better information from this image. And at the same exact time, your patient is going to experience a nearly 50% reduction in scan time. So that's less time in the bore, less time on the table, less time to deal with that uncomfortable position or being in pain from the position. And it's also going to help us increase compliance with being able to hold still and get through the exam. It really comes down to the classic, oh, wow, 10 minutes, I can do anything for 10 minutes. And that's where we're really breaking the mold with MRIs. The scans that normally take 30 minutes, we're experiencing about scan time now with our new technology. And it really is a win-win. It really has changed the game for us here at South Park. I've witnessed it firsthand with patients even accusing me of not doing everything that they needed done because the scan was so fast. And then I reassured them that with the new software, not only did we get everything we've always done for them in previous exams, we've even done it better than we've ever done it. So that's going to make our radiologist happy, like Dr. Mahanty, as well as you providers that are on the line today. So again, I really appreciate my couple of minutes with you guys. I'm going to turn it over to Dr. Scott Mahanty.
Thanks, Stephen. Hey, everybody. So thanks for taking your time over this lunch break. So I'm sure some of you have had MRIs before, family members have had MRIs. I know that you have some medical training and kind of different levels of experience and understanding of how an MRI works. So I just wanted to go through kind of 3 things for you to take home and hopefully be able to tell your patients and kind of prepare them for the experience and what we think is a much better experience overall. This is just a little chart here showing the Recon, which I'll talk a little bit more about. But basically, if you look for all these different types of MRIs, we're talking shoulder, L-spine, C-spine, hip, wrist, we're looking at a 40 to 50% decrease in the actual scan time, which is pretty impressive. And as you'll see, some better image quality as well. So from kind of the radiology side of things and the physics, MR physics side of things, we have a diagnostic dilemma when we try to improve the quality of an MRI image and also deal with kind of real world scan times and what a patient can tolerate. So really there's this inherent trade-off between a scan time, which as it gets longer, you will actually improve your signal to noise ratio and your resolution. However, if we're doing it for and this is going to lead to callbacks and rescans. And this also happens when you actually increase the length of the scan. We'll also talk about the 3T MRI technology. So I know a lot of you have heard about a 1.5 Tesla and a 3 Tesla. And we'll talk a little bit about that. And then again, we'll talk about this Recon DL, which I'm sure you've heard of artificial intelligence, machine learning, deep learning. To give you the kind of the textbook definition of what deep learning is, It's a subset of machine learning that uses convolutional neural networks. And really what it's doing is it's taking some MR imaging data and reconstructing it to provide higher signal to noise ratio and improved sharpness or resolution. So again, improved image quality, decreased background noise, improved scan times, and also there's just new coils we have as well. So let's take a look at some examples here. So here's the classic 1.5 Tesla versus 3 Tesla. So here at South Park, we have a 3 Tesla magnet, which is, as a radiologist, is wonderful. On the left on this image, this is a 1.5 Tesla image. And then on the right here, this is a 3 Tesla. And you can see just the graininess overall from the left to the right. It's improved on the right. And actually looking at cartilage, since I'm an MSK guy, you can actually see that the cartilage is much better seen, and you can see small defects. So you can actually imagine this tiny little defect in the patella here is actually causing a lot of pain probably in this patient. So 3 Tesla, what is it good for? It's really good for brain vascular imaging and musculoskeletal imaging. The issue we have with 3 Tesla is classically they're actually slightly longer scan times compared to 1.5. And you can also get slightly worse artifacts, and that has to do with the strength of the magnet. All right, so now we have this 3 Tesla magnet here, and on top of this, we're using a deep learning algorithm called Recon that is improving the resolution. So here's some examples from the textbook. Here on the left, you're seeing a conventional reconstruction that has kind of ill-defined abnormality within the cervical spinal cord. See these lesions a little bit better, as well as the cord signal, as well as the bone in the background. This one may be a little bit more subtle, but you see a conventional image acquisition. And then with the Recon, you can actually see the trabecular network and the cartilage surface better. So again, another great example, sharper images with Recon. Here's the conventional image, and here's the reconstruction, and you can actually see this trabecular networks within the first metatarsal much better. Another example here, and this is a great one. So image A, this is a conventional image acquisition. So this is, let's say, an image acquisition in a patient that moved a little bit, and you can actually see how it's grainy. You've got a little bit of motion, and this arrow is actually pointing out the axillary recess where there's quite a few important structures. I cannot even tell what's going on here. I'm using the same data and using the Recon, you can actually make out all these structures. You can see the sharpness here. Another kind of more subtle, useful, I guess, component of this is some of these images are acquired in 3D. So this is one image acquisition, but then we can take that same image set and then reconstruct it in any plane we want. So that means we're actually acquiring less sequences and again, decreasing scan time. Another great example. So this actually flips. So here's the Recon. And then you can see on the right, this is a conventional image. That same right hip MRI, this labral tear here was not seen on the conventional image. Some actual statistics here from South Park. Overall, you can see we're looking a lot faster. So here's a knee MRI and the traditional sequences we're going to acquire. This is average scan time for each sequence before instituting this deep learning algorithm, and this is after. So you can see for a knee, we're looking at 50% reduction. For a wrist, also very good. So again, as Stephen was saying, if you can handle anything for 10 minutes, hopefully this will be better for patients. Here's another great example. So here's a pediatric example. So this is a 3-year-old. So if you could imagine trying to keep a 3-year-old still in a small magnet. And the acquisition speeds are faster that you can barely see motion artifacts. So normally I'd be reading through a lot of motion artifact on this. So this is a great example. It doesn't require sedation. And overall, we're looking at better coils here too. So this is our lead tech here. And actually, I can probably let Stephen talk about some of these coils because he's a little bit more experienced with it here. But traditional, so this is basically a blanket that we can wrap around the patient. As to traditionally, we would be looking at something like a cage almost, right?
Yeah, that's correct, Dr. Mahanty. The new coils we have here also, the image on the right here, I can't help but to chuckle to see myself like that. But the coil on the right we refer to as a blanket coil, and it is a new technology with coils from GE as well. The previous designs or conventional coil in this scenario would not be able to be wrapped so close to the patient because the coils would start to actually work against each other and we'd get very poor image quality in the areas where those coils were so close. But with image resolution, the closer to the subject you place your coil, the better the image quality you're going to have. So with that said, you can see how with the blanket coil, when you can basically just take it and wrap the part around and not have to worry about how the relationship between the different components within the camera are going to fight with each other, it gives us a wide array of opportunities to get the camera closer to the patient, which is going to give you better image quality, but also allow them to be in a more natural position as well. So again, saving them time on the table, making them more comfortable in the process, and improving image quality all at the same time, which prior to these technologies coming together was impossible to do in the world of MRI. So these coils right here have been a real game changer as well for us with our patients, satisfaction and improving image quality for Dr. Mahanty.
Yeah. I mean, I would say overall, when I speak with my colleagues, my musculoskeletal colleagues, my neuro colleagues, they really find the image quality amazing. And so, hopefully we'll be able to tell you a little bit more about and get a little bit more information from each image and each study that you require. And I guess a little anecdotal story, my mother, probably a year ago now, actually maybe just before COVID, had her first MRI. And so she had mentioned it to me and I called and kind of prepared her. And she's a very stoic Midwestern woman. So she doesn't complain that often. So she called me immediately afterwards and she definitely chewed me out for not telling her how bad the experience was. So I kind of know firsthand that it can be difficult for a lot of people, and hopefully this new setup we have here will be great for years to come.
Okay, great. Thank you so much, Dr. Mahanty and Stephen, for giving us this really informative presentation. So for everyone on the line, we are now here at the Q&A portion. So again, you can submit your questions using the chat box feature in the Zoom platform, or if you would like to ask your question live and talk directly to Dr. Mahanty and Stephen, simply click on the raise your hand button and we will unmute you. So we'll go ahead and give it another minute or so for people to go ahead and start entering those questions, and then we'll answer those for you.
Hey guys, this is Travis. While we wait, I had a question. How do the providers know when their patient is going to get the 3T versus the other MRI?
Yeah, so that's a great question. I think so. A lot of it has to do with scheduling. So what I say is, you can request a certain magnet and you can write it in. I know that our schedule, we have a complex scheduling system, and Stephen, you'll probably speak more to it or better than I can. But basically what we try to do is with certain images like, a knee or a hip or a brain, we shunt them to certain magnets just because they're better quality images. So would you agree, Stephen?
Yeah, that's right. We do have kind of a setup workflow already where we have several different scans that are designed to go to the 3T already. So we do look for a lot of the hips to be pushed to 3T. Any small part, we're trying to kind of steer toward the 3 Tesla as well here at South Park. And then in some body imaging is prostate imaging. prostate imaging, rectal cancer imaging automatically comes to 3T. That's just the radiologist preference and protocol there. But like Dr. Mahanty alluded to, any scan that you would prefer to be scanned on 3T, you can, in the special instructions, request that the patient go to South Park or request to be done on 3T. So that's a great question, Travis.
Yeah, and Travis, this is probably like, almost our test site, right? So hopefully, if things go well here, if we're seeing better patient satisfaction scores, improved images, this is something that we want to roll out throughout the whole network. And so, eventually, that question is, well, all of your patients will be going to a site like this. So,
well, thank you.
Yeah, of course. Yeah.
Can I add, just to add one thing onto what Dr. Mahanty just said, we do have, they also have the Caring Suite technology, and not to speak too soon, but we are looking at the possibility of adding the Air Recon to those locations as well in the future. But right now we do have Ballantyne and our Huntersville office that currently already have the open bore technology as well as the Caring Suite. A little bit of music and lights go a long way with an experience like an MRI.
There's a question here from Cameron. So any future updates with regards to upright capabilities or CSF flow studies? Do you know anything about upright capabilities yet?
No, we are currently, I'm not aware of Charlotte Radiology looking at any upright capabilities currently. And as far as CSF flow studies, we currently already do CSF flow studies essentially at all of our locations. So that is a imaging option that is currently available now. So that would be a way, if you have a question about how to order a CSF flow study, you can order an MRI of the brain and or cervical spine. And then in the comments, you would need to include CSF flow study analysis, because that is a technology that we already have in place and are currently utilizing at all of our Charlotte Radiology Carolinas Imaging Services locations. It's a great question.
You're welcome.
Thank you. All right, so we'll give it another minute or so for any other last minute questions to come by. If you guys can't think of any other questions, or if questions come to you later on, Dr. Mahanty and Stephen do have their email address here on the slide, and this recording will be sent to you guys later this afternoon as well. So you'll be able to reference any part of this discussion.
Hey, sorry. Hey, it's Bob from Charlotte Radiology. Just wanted to chime in. I just want to answer Stephen's questions earlier. Yes, ARDL, the faster sequences will be applied to all of the Carolinas Imaging Services magnets in early 2022. So that's already been approved.
Thanks for that, Bob. And I was just going to mention also, because it is something that kind of has come up a couple of times. We do not charge any differently for the 3T than we do the 1.5. So no matter where you send your patient, they're going to receive the same quality care and the same price, regardless of which system they're scanned on.
Thank you, Stephen. All right, so we do have another question that just came in. The question is this technology specific to MSK imaging, or does it apply to body and neuro imaging as well?
I believe, yeah, sorry, Alexa, you cut out a little bit.
Sorry about
the question was probably, does this only apply to neuro and MSK, or does it apply to everything?
Right, yeah, the question is this technology specific to MSK, or does it apply to body and neuro also?
Yeah, okay, yeah, so no, it actually, I have my MSK bias, which is why this talk was an MSK bias talk, but no, it actually applies to all technologies. So it is going to be most useful in something that has very small anatomic structures, so neuro and MSK. It also applies to body, so we use the same technology body, decreasing the scan time. The resolution in some of those kind of studies probably doesn't matter as much because we're dealing with bigger organs, but you do get the improved image quality and the reduced scan time as well. So yes, applies to everything is the answer.
Okay, great, thank you. All right, so I don't see
with the body imaging portion. Go ahead, Alexa.
Oh no, go ahead, Stephen, go ahead.
Oh, I was just gonna, just to kind of close the loop on the body imaging question there. We've actually seen significant improvement in our prostate imaging, as well as female pelvis, rectal cancer studies. Again, those are areas where very small structures and high resolution is of the utmost importance. So we saw great gains there as well, and especially with our prostate. Our routine prostate protocol was taking us about 47 to 48 minutes on the table. And now with Air Recon, we were able to cut that table time down to under 30 minutes or very close to 30 minutes with improved resolution and quality that made our body radiologists very excited, made their job a lot easier.
Hey guys, this is Travis. One final question for me. As the providers feed this information to their patients, what maybe one or two takeaways should they share with their patients on this change?
Yeah, so when you're having the discussion, so kind of doctor to patient discussion, you're saying, hey, we're going to order you an MRI. And let's just say theoretically you have some pushback. You can say, hey, one, we're sending you to a new scanner with some new technology that will cut your scan time in half, as well as to give the radiologist, as well as, you know, if you're a surgeon or something, basically better image quality that will improve our diagnostic ability and improve their care.
Thank you.
Sure.
Fantastic. Well, I don't see any other questions coming through, and we are close to the top of the hour. So again, thank you so much, Stephen and Dr. Mahanty, for taking time today for giving this presentation. And thank you to everyone on the line who also tuned in on your lunch hour. As I mentioned, a copy of this recording will be sent out to you later this afternoon via email. And I appreciate everyone's time and have a great rest of your day.